You know, what's exciting to me as a scientist is to even be able to contemplate this idea and to have such a powerful tool where we can see if we can. You know, what happens is atherosclerosis, which is really the disease we're talking about, clogging of the arteries with cholesterol, starts at age 2 in America, and then it just progresses over many decades, so people start having heart attacks and strokes in their 50s, 60s, and 70s usually. You know, we'd like to treat people who already have a lot of atherosclerosis, in their 50s, 60s, and 70s to prevent heart attacks and strokes. But, this drug actually gives us the opportunity to think about, well, maybe we should start treating earlier, and if we can prevent atherosclerosis from even progressing earlier, that's, all of us doctors would love to never have a patient have an event, so it would be great. And I'm also wear a public health hat, so that's, to eliminate the major cause of mortality in America would be pretty exciting. Now that's all speculative. I have to counter that, but that's, I think that's why there's a lot of enthusiasm, amongst the community for this new class of agents. That's what we've learned over the last several decades of research, and actually I was just on the recent cholesterol guidelines, and we actually got rid of LDL treatment thresholds and targets because we found out like everybody's cholesterol is too high. And depending on their number of risk factors and how old they are, many would benefit from cholesterol lowering regardless of their cholesterol. All of us would love if everybody ate a heart-healthy diet, exercised regularly, and was skinny as a rail. But since that's not what America looks like, we need some way to. Now statins are a huge step in that direction, and they are generic, and so cost is always an issue, but it seems like we need more in a lot of people. So this is why this new class of drugs is exciting. Everybody, it was kind of a dry spell in cholesterol for a while after the statins, and now there must be 20 or 30 new drugs in development, not just LDL lowering drugs, but HDL raising drugs and triglyceride lowering drugs. So a lot of excitement, but we really need to prove that they reduce cardiovascular events, because that's the point of it. It's not to make numbers look better, it's to prevent heart attacks and strokes. So that's why we have to go through all these big clinical trials and things to prove these new drugs work.